If you fast, it activates a process called as autophagy. Autophagy is where your body is going to remove the bad cells or precancerous cells. There are many conditions which are painless. We understand when there is pain. When there is no pain, then that does not mean you don't have problem, and that's why after the age of 40 you want to do health checks, because certain diseases will be there but they would be in painless state, you would miss them.
Liver detox drinks cleans and heal your liver. Do we have any liver detox drinks?
So it's like telling go and have a bath in Ganga, sare paap dhul jayenge. I don't think so. That tells you the answer actually. We had one gentleman weighing around 135 kg. 135 kg, and he had jaundice, the yellow eyes and urine, severe pain, and he came in a comatose state, as in he was not identifying, recognized, talking, and his blood pressure was only 50. It's very, very low blood pressure. So this was all because of infection. And the cause of infection in this gentleman was one of the gallbladder stone had actually fallen into the bile duct.
Okay.
And the whole bile duct had got blocked. That is why the patient's bilirubin or the patient had jaundice, and he had infection, and that infection had caused significant lowering of the blood pressure.
Your digestive system is more powerful than you think. It's often called the second brain for a reason. From regulating mood to supporting immunity, your gut plays a crucial role in your overall health. In this episode, we explore how modern gastroenterology is transforming the way we understand our digestive systems. We will break down the latest advances in diagnosis and treatment, maybe from minimally invasive endoscopy to AI assisted tools. Plus, we will clear up some more common myths about spicy food, fatty liver, probiotics, and much more. Whether you are dealing with a digestive issue or want a good gut health, this conversation is packed with practical insights that can get you and help you feel better and best inside out. Joining us today is Dr. Dhaval Choksi, a leading gastroenterologist at Sahyadri Super Specialty Hospital, Nasik, with specialized expertise in advanced pancreatico-biliary endoscopy and liver care. A gold medalist and a recipient of prestigious Torrent Young Scholars Award, Dr. Choksi has performed one of the highest numbers of pancreatic ERCPs in North Maharashtra. Trained in endoscopic ultrasound, he brings cutting-edge techniques to the region. With numerous national and international publications, he continues to be a key voice in the evolving field of gastroenterology. Let's welcome Dr. Dhaval Choksi. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Dhaval Choksi. Hello sir, how are you?
Hello, I'm fine, all good.
Welcome to Sahyadri Health Talks.
Thank you so much.
Today we have a very exciting topic to talk about, which is advancements in gastroenterology. So before I jump into that topic and we try to understand all about it, so how has this journey been of gastroenterology for you?
It's been wonderful. Much beyond what I expected to be.
Achha.
I'm very happy to be here.
Was it a planned decision of becoming a gastroenterologist, or do we call it a destiny?
It was pretty much planned from day one of my MBBS. I wanted to do something with gastroenterology, not a medical or a surgical. That was not decided. But yeah, something related to soft tissues of the body. So that is what I wanted to do.
So this, the entire journey has been of great, and I was just going through the introduction part of yours, and I am just amazed at all the achievements that you have done. So a big congratulations on that to begin with. And I was really excited to know that when I asked you that what would be today's topic, instead of choosing an ailment or a condition, you said it should be on the advancements of gastroenterology.
Correct.
So tell us the reason behind this.
So I'm sure you all are aware that the world is moving at a very fast pace. And if you do not keep pace with the moving world, I am sure we all will be thrown out.
True.
At the same time, technology has made wonders in all the fields, and gastroenterology is no exception. So the purpose of this topic was we all should incorporate the good things which the technology brings, and make our lives more better.
Mhm.
So with this thought, I thought this was the right topic. That's how
Ah,
we came up with this.
with this. So, without delaying it further, tell
Yeah.
us what advancements excites you more about gastroenterology in terms of the technological, development with AI coming in picture. What are your thoughts and what excites you?
So see, gastroenterology is that we are pretty vast field.
Mhm.
If I have to break into smaller segments so that we understand better, one part is endoscopies,
Mhm.
second part is liver, and third part is the medicine aspect.
Acha.
If you see endoscopies, so what has happened over the last decade or so? You have advancement in terms of certain endoscopic procedures. Let me quote them.
Mhm.
First is something called as ERCP.
ERCP.
Second is a cholangioscopy.
Mhm.
Third is endoscopic ultrasound. And fourth is third space endoscopy. So for a normal individual, these terms might look a bit difficult, but I'll try to make it simpler.
Mhm.
So what has endoscopy actually done is, with these endoscopic techniques and technologies, we are now not only identifying a problem, we are solving a problem. That is going from diagnosis
To
to
the
treatment.
treatment and complete cure.
Correct. That is one. Second, we are going from an era of open surgery
Mhm.
to laparoscopy to minimally invasive surgery. And third, we are reaching those parts of the body which are previously thought to be inaccessible.
Mhm.
So all these things are happening in the world of endoscopy,
Acha.
which brings a sea change in patients' day-to-day care.
Mhm. Mhm.
So this is with regards to endoscopy. If we say liver, let me tell you, there has been an immense change which has happened in the way we treat liver patients.
Mhm.
And the most important thing is liver transplant. Let me give a quote in my own family. One of very close family members had end-stage liver disease back in
Mhm.
2007, and she needed a liver transplant. We inquired at Delhi. At that time, there were hardly a couple of centers, and the cost was upfront of 50 lakhs.
And this is you are talking about
2007.
2007.
Today we are in 2025.
Mhm.
The cost of liver transplant is somewhere around 20-25 lakhs. Now you tell me, over the period of 18 years, 17, 18 years, tell
Mhm.
me one commodity whose
Which
price
has
has gone
gone
down
down.
like
Correct.
less than 50%.
Yeah.
Everything has
Depreciation.
everything has become three times. 100 rupees in
Yeah.
2007 was 300 rupees today.
Yes,
It's
true.
a big change.
Big change.
In the world of medicine, if I have to tell, you have hepatitis C virus. There is a drug which previously there was no treatment. Back in 2007, there were hardly any molecules available. I mean, 2013, 2014, we got a tablet for that.
Mm-hmm.
That is called a sofosbuvir.
Acha.
The cost of the tablet was 84,000 US dollars.
One tablet.
Eight for the whole treatment.
Acha.
84,000 US dollars, the whole
Whole
treatment, 3 to
treatment.
6 months. Today, we are completing the whole treatment in India for around 24,000 rupees. That is 84,000 US dollars.
To 24,000 Indian rupees.
Rupees. Yeah, that's the sea change. So we have seen immense progress, not just in endoscopy, but in liver, in terms of liver transplant and the way we care for liver patients, very
Mm-hmm.
sick liver patients, and also the medicines which we use in gastroenterology. One of the examples which I gave.
Mm-hmm. So these are more kind of, because advancements have entered the field and is
Yeah,
also more accessible to a
correct,
greater,
correct, correct.
population. That's the reason you are saying.
Yeah,
So as you said, mentioned the word ERCP and
yeah,
advancements in ERCP. Can you
yeah.
elaborate more on
So
those?
see, we all know there is something called as gallbladder,
Mm-hmm.
pittashay, what we commonly call,
Yes.
and the commonest disease is stones in the gallbladder.
Gallbladder.
Very common,
Yes.
especially in the northern part of the country.
Yeah.
So many a times those stones come and fall in the bile duct, pitta
Acha.
nalika.
Pitta nalika.
So it's around 4 to 6 mm in size.
Mm-hmm.
So if that stone gets stuck,
Mm.
you identify and you treat it with an endoscopic procedure called as ERCP,
Mm.
endoscopic retrograde cholangiopancreatography. That's a pretty big
Acha.
name. So to make it easy, it's ERCP.
ERCP.
Similarly, you have swadopind, which is called as pancreas,
Mm-hmm.
and you have the pancreatic duct,
Mm-hmm.
which is around 2 to 4 millimeters in size.
Mm-hmm.
So ERCP helps you to identify, diagnose, and treat
Mm-hmm.
problems of bile duct and the pancreas duct.
Mm-hmm.
So that is with ERCP.
Mhm.
Pretty challenging, but gives immense outcomes, very satisfying, not just for the doctor but also for the patient.
Okay. So when we are talking about advancements, no discussion is over without the intervention of AI. So
Correct.
what's the role AI has played when it comes to, maybe colonoscopy or endoscopy?
Yeah.
What role does
Yeah.
AI play here?
So the way we see AI getting into all the aspects of life, we are no exception. And we see that AI definitely has a role in gastroenterology. One of the earliest use of AI in gastroenterology was in colonoscopy. So
Acha.
basically, when you do colonoscopy, you are doing endoscopy of the large intestine.
Acha.
The large intestine is called as a colon. So it's an
Mhm.
endoscopy of the colon called as colonoscopy. The purpose is very simple. You want to identify cancer in the large intestine. But
Mhm.
that's a pretty common place to have a cancer.
Mhm.
So by an endoscopic imaging, you will see the intestine, the large intestine, and find the cancer or the early stage of cancer, which is called as a polyp. So when we do colonoscopy, if in the system, the endoscopic system, if we can incorporate the AI software while doing the endoscopy, very very small polyps can be identified which could have been actually missed by the endoscopist. So you will get the red flag or you will get those green square, the way we get those facial recognitions. So it'll pick up those polyps so that we don't miss those polyps. And once we identify those polyps, we just remove them so that the subsequent risk of cancer goes down. So that's how we are incorporated. So gastroenterology, a lot of diagnostic parts are there. So in all the diagnostic part, AI will come into picture.
Yeah, I will come into picture. So how does the entire phase of treatment, or your line of approach for cases like IBD, which is irritable bowel disease, or GERD, or fatty liver? So how has this advancement helped you in treating these patients better?
So if we look at IBD,
Because I think these are the three most
very
common,
common, very common GI
issues.
problems. Yeah. So we start with simple disease, and that is GRD. So GRD, which commonly people understand as acidity. So
हाँ,
what
which
do
is
you
like
feel?
खट्टी ढकारे
खट्टी
आना,
डकारे आती है, reflux होता है,
हाँ,
you get burning
burning
sensation in your chin.
sensation.
So what is that? There is nothing but reflux of the acid in the food pipe,
Yeah.
esophagus.
Yeah.
So previously what used to happen was you would be given some antacids,
Yeah.
and that would be the ultimate fate of the patient.
Yeah.
ये लो जिंदगी भर acidity
जिंदगी
गोली खाओ,
भर एसिडिटी की गोली खाओ.
and some food restrictions.
Yeah, of course.
So nowadays, this is what we are doing, is we are going beyond this. So what we do is we will do endoscopy and see. Generally, the problem is there is a valve here which is not functioning well,
अच्छा.
and you have grades of that. So we segregate from that level that all those patients who need medical care and good dietary lifestyle regulation, those are maintained on that. But there is a subset of patient where the valve is functioning very poorly. These patients are subsequently subjected to advanced tests like esophageal manometry.
अच्छा.
We look at the pressure or the functioning of that valve.
अच्छा. That's
And
specific to that
yeah,
valve.
specific to that valve which is malfunctioning, and rest of the food pipe, how well it is contracting.
अच्छा.
And once you identify, there is a big subset of patient who are going to need a surgical correction of that valve. That would be in the form of a fundoplication surgery or endoscopic surgery in the form of Gerdix. So once you identify, you treat these patients. See, remember, it's not one size which fits all. Okay, so there will be a subset of patients who are going to feel very good with medicine. You never want to subject them to surgery. But there will be subset of patients who will need surgery. Unless and until you correct this malfunctioning valve, you're not going to get the desired result.
Correct.
So here what we do is, this is what the holistic approach is. You treat medically, check endoscopically, need be manometry and surgery. So that's how we approach GRD. If you talk of fatty liver, again, almost 35 to 40% of Indians suffer from fatty liver disease. So apart from the routine tests which are obviously being done, we will also have a look at their liver using advanced tests in the form of a fibroscan, which is going to tell us how the liver is, how much is the fat deposition, how much is the fibrosis or scarring, and subsequently treat this patient.
Yeah, and I also believe this fibroscan is much more convenient than the traditional gold standards of liver biopsy, which was liver biopsy, right?
So previously we would be doing liver biopsies to identify and find out and confirm this. Nowadays, we usually use fibroscan. Obviously, there would be a subset of patients who would need a liver
Liver
biopsy.
biopsy.
But then, with the advent of fibroscan, this becomes much more easier. And you see, we are able to, counsel or show the result very objectively to the patient. So, for example, I tell you that, you have F4 fibrosis. You would not understand a word of it.
Yeah.
But if I tell you that, your fibrosis score is, say, for example, 12, and we want it less than 7, you are very easy to understand that, and you are obviously going to make the necessary changes. So that way, it is good for the patient to understand and be involved in his own treatment.
Also it also kind of acts as a parameter which the patient can be closely monitoring
Absolutely.
while they are on the treatment. It also
Absolutely.
kind of helps them understand the efficiency of the treatment.
Correct.
If I'm not
So I
wrong.
tell you, your hemoglobin is 7.
Huh.
I'm starting you on treatment. Your
Yeah.
HB has gone 12. You'll
Yeah.
be very confident. Okay,
Huh.
yeah, I'm on the right track.
And then
it's as simple as
I'll
that.
get myself checked maybe again in a couple of months and to check if my HB levels have gone up.
Absolutely.
So with advancements like fibroscan, this has become very easy.
Correct.
So what are the advancements that we are seeing in cases of gastrointestinal cancers or cancers related to the gut?
So again, the technologies and the techniques which we just described, those are the ones which are going to be used to identify cancers at a very early stage. I'll quote a simple example. So we had a patient who would repeatedly become unconscious early in the morning.
Acha.
And when his blood sugars were checked, they would be like 30, 40.
Acha.
Very odd. Okay, so this is classically seen in a condition called as insulinoma. So it's a cancer where you have a tumor of insulin secreting cells. So you have a lot of insulin in the body. That insulin decreases blood sugar. And this patient was subjected to all the scans, and we could not find.
Is this a very rare one or
it's a
very
rare
common
one? It's a pretty rare one.
Pretty rare one.
So with the conventional scanning, we could not identify anything like that. So we did endoscopic ultrasound for this patient, EUS, what we call. And on EUS, we found a small 8 mm tumor in the pancreatic tail. And with biopsy, we identified that this was the tumor which was causing the symptoms. And subsequently, the patient underwent surgery, distal pancreatectomy, and patient was cured of the problem. So we have technologies like EUS, you have magnification endoscopes, those help to find out cancer at the early stage, or when they are in the stage 1. So this is how the technology is helping us.
So when it comes to the gut health, right? Gut is also called as the second brain of the body.
Yeah, absolutely.
And there is a reason behind it, because
True.
there are so many things which is going on there, be it the microbial flora which is there in the gut. So and understanding this microbial flora becomes very important.
Correct.
Because it is one of the things which can go bad under influence of certain drugs or something like that. How has this understanding of the microbial flora improvised or helped us better understanding them through this advancements or technology?
So first, to put it more simpler, we are in very, very primitive stage of understanding the gut flora.
Yeah.
That's number one.
Yeah.
Number two is, we Indians respect food as good as God, right?
Yeah.
It's Anna is Brahma, right?
Yes.
This food passes and comes out as a poop. And then it's shit we are not supposed to
and we are not
so
what
happens in these 6 hours or 12 hours 24 hours? What happens? How does it become from as respectful as a divine or godlike to something shit?
Yeah.
So the thing is, our intestine is studded with the bacteria and viruses. In fact, science says that in 1 gram of stool you have 100 billion bacteria. So this is the gut flora. We've just trying to understand the gut flora right now, but definitely it has a huge role. And our science probably our ancestors understood this, and that's why they asked for eating curd in our everyday, because it is supposed
the
to
natural
have the
provider.
Yeah, absolutely.
So that's the role of the gut and the gut flora.
True.
So when it comes to the biologic and the targeted therapies, right, in the management of Crohn's and ulcerative colitis, what advancements are we seeing here?
So see, Crohn's disease or ulcerative colitis is inflammatory bowel disease, IBD. So putting in simple words is, these are the condition where you will get ulcers in the intestine.
Acha.
So it's very simple. You have a lot of ulcers. Those ulcers will cause diarrhea, pain, and bleeding.
Mm-hmm.
Now, these diseases actually occur through certain chemicals or molecules.
Mm-hmm.
By targeted therapy, what we mean is we're trying to neutralize those. For example, you have air defense system, Operation Sindoor, we all know. So those air defense system are going to nullify the enemy drones
Mm-hmm.
or missiles or the
Mm-hmm.
aircrafts.
Mm-hmm.
We're targeting those individually. Similarly, in IBD, we are targeting those individual molecules which
Acha.
are causing ulcers.
Okay.
Previously, we didn't have these molecules,
Mm-hmm.
so we would start with something simple medicine and then stepwise go up. So this is called as step up approach. Nowadays, with advent of these molecules,
We
we
directly go and
go
hit the target.
top down.
Yeah.
The reason is if you correct the disease in the first step,
Mm-hmm.
you are going to change the natural history.
Yeah.
Otherwise, the patient will become bad and then you will try to rectify. By that time, there is a lot of scarring and permanent
Collateral
damage. You don't want the permanent damage to be
Yeah.
there. So that's how these molecules are making big impact.
Mm-hmm. Mm-hmm. So, what when it comes to liver cirrhosis or portal hypertension,
Yeah.
what are your thoughts on those with the advancements?
Yeah. I feel again I would tell the same thing. The biggest advancement is the ability to do liver transplant. When one of my keen, what I said, 2007. So eventually, she expired. We lost her, and I felt pretty bad. I was in third MBBS back then, and since then it was there in my mind that maybe one day we should be able to offer something of that sort of that level
Mm-hmm.
in Nasik and the area around where I stay. And I feel very happy, very humble with the fact that we have conducted the first living liver transplant of Nasik and North Maharashtra
Wow.
a year and a half back.
Lovely.
Yeah, so my dream of 2007 actually saw the day of light in 2025.
Lovely.
Since then, we've been doing liver transplant at Sahyadri Nasik.
And seeing a beautiful results with every case that comes up.
So it's very satisfying
Mhm.
because something which was a motivation factor, we could actually make a good use of it and reach to this level.
So, as you spoke about, the most advancements and including the liver transplants, one thing which is very common in discussion these days is minimally invasive procedures.
Yeah.
So, what are the other minimally invasive procedures which are really doing very well, and you are seeing very promising results
Correct.
when it comes to gastroenterology?
So here one of the procedure which we do is endoscopic ultrasound.
Mm-hmm.
Where I'll give a simple example. There are many patients who have pancreas problem, and
Acha.
after the problem of pancreatitis, they get a big collection of bad fluid in the abdomen. Previously, these patients would be treated by open surgery. Then came the era of laparoscopic surgery. Now we are doing these procedures using endoscopic ultrasound.
Mm-hmm.
And with this procedure, the patient goes home the next day without a single stitch on the abdomen. That's the beauty of technology.
So it's absolutely scarless.
Yeah, scarless. Similarly, we are doing third space endoscopy where you have early GI cancers. So the GI wall has 4 layers, and usually the cancer starts from the innermost layer. With these technological advancements, we are able to chip off or remove the tumor from layer 1 and layer 2
Acha.
without cutting or resecting the intestine.
Acha.
Again, it's a scarless, and patient goes home second day, third day.
Mm-hmm.
And let me tell you, it's a big boon for a patient.
Mm-hmm.
Somebody who's undergone an abdominal surgery will be able to tell you how bad it is to have your abdomen open. So all these things being able to do without scar, patient going home on second day, dramatically cutting down the cost and the quality of life being remaining amazing is what is the beauty of technology.
Yeah. While we talk about all the advancements, are there any upcoming advancements or newer technologies which are expected in gastroenterology and which you are really hopeful that we can see in upcoming days?
Yeah. So what we rather have getting those technologies, what we hope is we being able to get the cost even down further, and that is likely to happen with we getting more and more machineries. So for example, previously for ERCP, patients would travel to Mumbai, Pune, or some bigger centers like Hyderabad. For endoscopic ultrasound, they would be again traveling. For all these problems now, they don't need to travel anywhere. We are able to offer all those facilities here. I guess right now what GI is offering is phenomenal. I mean,
Hmm.
rather at this point of time, I can't expect more. I mean, what we are getting right now is much more than what would expect.
Yeah. So one advancement in fields of gastroenterology which you feel every setup or hospital must have.
So as of now, everybody needs to have an upper GI, lower GI, and a good ERCP thing. That's the bare minimum which we expect. Anything beyond that is wonderful to have.
Mm-hmm.
But let me tell you, these things are not easy. They are pretty costly. You need a lot of training. It's not that you finish your course and you can start these things. These are high risk procedures. You need to be mentored properly. You need to have sound analysis of all these things what you're doing. So for a day-to-day center, all these things may not be feasible. But
Mm-hmm.
for a good setup where you have multiple team members doing in, you have all the infra machineries. Because see, if you're doing high-end stuff, there would be days where you would get complications,
Correct.
and you need
Should be
to,
able to handle
yeah,
those
you should
complications.
be able to handle complication. It shouldn't happen that you've tried something new,
Hmm.
you've created a complication and you're
Mm-hmm.
not able to sort it. If you're not able to handle your complications, please don't do these things.
Mm-hmm. So you just mentioned the word team, right?
Yeah,
So
yeah.
what does a typical gastro team looks like? I mean, what all are
So
the
so
elements
yeah,
of the
so if
gastro team?
if you see our lives, our day-to-day life, I need to quote my Monday.
Yeah.
So it would be, coming up early in the morning, taking our rounds, especially the sicker patients in the ICU, having a list of OPD patients, and we'll have a list of our patients who have come fasting state for their endoscopies.
Yeah.
So we'll be starting with our endoscopies, and in between the procedures, we would be juggling with our OPDs. And at the same time, by the noon or post afternoon session,
Mm.
we would be going through the records of all the patients what we've done so far, and subsequently planning the next day's procedure.
Mm.
And late evening, we would be going through our literatures, whatever difficulties we've had, and going through the journals and publications, and at the same time, uh, reading, because as I said, these technologies are upcoming, we also
Mm-hmm.
want to upgrade.
Mm-hmm.
So all these things you can't do single handedly. Of course, there would be team of people. You would have consultants, you have endoscopy team members, you have
Mm-hmm.
nursing staff, you will have receptionists, your RMOs. So it's not a one man's job.
So what keeps you going? Such a hectic schedule, and what keeps you down to the earth?
Uh, it's the passion.
So I
It's
think,
the love for the branch basically.
uh-huh.
So I guess that passion is enough.
So, from that note of passion, moving to the next segment, which is quick mythbusters. I'll read out a few
Yeah,
questions. You'll have to tell us if it's a myth or a fact,
yeah.
and if it's a whether it's a myth or a fact, help us with
Well,
one line
sure.
explanation. So, one test every adult should get after 40
I think so. A complete health checkup, which
is a
costs
must.
something around 3,500 to 5,000. See, no single test is going to tell you. You do an
Mhm.
MRI of 10,000 rupees, it will not
Mm.
tell you your blood sugar, which
Mhm.
costs 75 rupees.
Mhm.
So you can't have a single test. But basic thing, what is expected is do a complete health check
Mhm.
once a year.
Okay. Coffee, good or bad for the gut?
Good for liver,
Mm-hmm.
not so good for those who have acidity or dyspepsia.
Yeah, okay. Because of late, all these things are going on that coffee detoxes your liver,
Yeah,
black
so
coffee.
correct.
So many people who never liked
Had coffee,
coffee
yeah.
are also
Yeah,
getting into that
yeah.
black coffee mode.
So the answer is good for liver,
Okay.
not so good for those who
How
have
many
acidity.
how many cups are okay?
3.
3 cups in a day are okay.
Yeah.
Okay. Probiotics, fad or future?
Definitely future, not fad, but we are far from getting the ideal one.
Okay. So as of now, curd can be considered as a.
Absolutely, yogurt.
Are there any other natural probiotics that you recommend?
Curd is the best one,
Curd is
easily available.
Okay. One gut friendly food you swear by?
Moong dal khichdi.
Moong dal khichdi.
Yeah, yeah.
Any particular reason?
I guess it's the complete food, and it does not cause any symptom.
Mm-hmm.
Very, very good for your large intestine or overall GI health and nutrition point of view as well.
Yes. Well, okay. Most underrated sign of a digestive issue?
Lack of hunger sensation, what we call as anorexia,
Mm-hmm.
and the second is bleeding per rectum, also bleeding through the stools. But lack of hunger. If you see Ayurved, they would or our ancestors they would say, good sleep,
Mm-hmm.
good hunger sensation, and daily potty. So these are the signs where
That
a
you're
person is
living
good. You
healthy.
don't need anything else. So that's a surrogate marker.
Okay. Uh, Late night snacking, harmless or harmful?
Never ever do.
Never ever do it.
Yeah.
So,
So one gift you
post.
wanted to give to your body would
Huh.
be early dinner and early sleep. That would
Okay.
be the ideal gift for your body.
Okay, and no midnight munching.
Never.
Okay. Favorite part of being a gastroenterologist?
I guess it's the best of both worlds. We can live as physicians,
Uh-huh.
prescribe medicine. We can live like surgeons,
Uh-huh.
where we do a lot of endoscopies.
And the procedures.
We can do liver transplants, as in be a part of the transplant team.
Mhm.
So it offers us such a wide variety of spectrum
Mm.
that every gastroenterologist will find his,
Fit in some
yeah,
role somewhere.
exactly.
Yeah. Okay. One thing you wish everyone knew about digestion.
Uh, I guess the two symptoms which I told, lack of
Lack of-
hunger, always ensure that you get checked.
Mhm.
And don't take bleeding while defecation, while passing stool, as something
Mhm.
lightly, because I
Mhm.
have seen many patients who feel that this was piles,
Mhm.
turn out to be a colon cancer.
Oh my God.
So never take this symptom lightly.
Okay. Okay. Spicy food causes stomach ulcer. Myth or fact?
It doesn't cause, but obviously it would worsen the symptoms. So it would not cause, but you don't, it's applying chili, you would apply chili on your wound? No, you would never.
Only alcoholics get fatty liver.
It's a big myth. So almost 35-40% of Indians have fatty liver.
Mhm.
It's the obesity, overweight, and lack of physical exercise which causes fatty liver.
Mhm.
I quote my own example during my exam period where I was just sitting, eating, and studying.
Mhm.
After my exams, I had to do an ultrasound abdomen for some other reason,
Mhm.
and I had fatty liver. And I was surprised because my weight was back then, it was still in the ideal range with a
Mhm.
normal BMI.
Acha.
I started exercising and it went away.
It went
So
away.
lack of exercise is very important. In
Lack
fact, we
of
have
physical
something called as lean fatty liver.
Acha.
That
It
is
is like
also there.
fatty
So,
liver in thin
in the
people.
thin people. So exercising is very important, not just
Acha.
alcoholics.
Acha. Heartburn is always a sign of heart problem. I think it's
No, so in GRD we get heartburn,
Uh-huh.
but the message is actually the other way around. You
Uh-huh.
don't want to think
Everything
heart
is a-
attack as acidity. So that is
Acha.
more
Yes,
problematic.
yes,
There are
yes.
many people who kuch nahi acidity tha, you do
Ah.
ECG, you come to know is heart attack.
Ah.
There's another condition in gastro which is gallbladder stone.
Mhm.
That also comes with similar kind of symptoms,
Yes.
and patient feels that I have just acidity.
Mhm.
So you don't want to miss gallstone or heart attack. With acidity, you're not going to die, but with heart attack not diagnosed,
Ah.
you will die.
You will die. Yes. Colonoscopy is painful and dangerous.
No, so it is not at all dangerous, and it is that way pretty much easy. In fact, majority of my patients do it without sedation,
Acha.
just local anesthesia.
Acha. Fasting regularly keeps your gut clean and healthy. Yes, I personally wanted to know this. I mean, we have heard so much about it. Ki fasting karo, so it detox your body. Is it true?
So very much true. Very simple example. Suppose you want to clean your home.
Mhm.
If you are working 12 hours a shift, will you get time to clean your home?
No, of course not.
So you want off, right?
Mhm.
Similarly, if you're off from your duty of eating and digesting, and from that digested food preparing this whole body, the muscles, the blood, the bone, and everything,
Mhm.
it's the only time if you're fasting,
Mhm.
that is when you will be able to give time to your body to heal.
So when you say fasting, see,
Yeah.
India is a place where we have so many cultures and
Correct.
religions that we
Correct.
follow.
Correct.
So there are certain, cultural beliefs,
Yes.
and what I'm going to talk about
Yes,
is the
yes, yes.
Nirjala Upvas.
Yes.
So what are your thoughts on that?
So how I understand is fasting is two-way. One is spiritual and other is physical. Physical is very easy to understand, that you are not going to eat. The purpose is you're not going to give any work to your body, so that your body is going to clean the body from inside. It gets time. So you have a scientist called as Osumi, who received Nobel Prize in 2016, because he said that if you fast, it activates a process called as autophagy. Autophagy is where your body is going to remove the bad cells or precancerous cells.
Acha.
So that decreases chances of cancer as well.
Mm-hmm.
So when you don't eat, you give time to your body to heal, to recuperate.
Mm-hmm.
So this is a physical aspect.
Mm-hmm.
There's also a spiritual aspect to this. fasting means staying away from your senses.
Mm-hmm.
So the most primitive sense is food or hunger.
Hunger.
So anybody who can control his hunger,
Mm-hmm.
he can control all his five senses.
Mm-hmm.
That was the purpose of fasting, and that's why we have Ekadashi, where
Yeah.
every 15 days you would fast.
Mm-hmm.
And the ideal way of fast is
Mm.
you be on water.
Mm-hmm.
Some people are not able to tolerate that, so then they will go on fruits, somebody would go on milk, and then we start having all the items which one
Yeah.
can have on
फास्ट
fasting.
में ये भी खा सकते हैं,
So,
फास्ट में ये भी खा सकते हैं,
पूरे दुनिया का खाना खाइए.
फिर
In fact,
फास्ट
they'll
में
eat
ज्यादा
more.
खा लिया.
True, true.
Okay. All probiotics are the same and work for everyone. Does
No.
all probiotic work for
No,
everybody?
as I said, we are very in the primitive stage of understanding this whole science of gut flora.
Mhm. Mhm. No symptoms means your digestive system is perfectly fine.
Never. There are many conditions which are painless. We understand when there is pain. When there is no pain, then that does not mean you don't have problem. And that's why after the age of 40, you want to do health checks, because certain diseases will be there, but they would be in painless state. You would miss them.
Mhm, mhm, mhm. Once an ulcer is treated, it never comes back.
No, if the underlying cause is not eliminated. Suppose I keep on popping painkiller drugs for my headache or back pain or knee pain,
Mhm.
I will have ulcer because of those painkillers. So
True.
if you remove the cause, then they won't come. They can come anytime.
Bloating always means you are gassy.
No. So bloating is you feel full. That fullness could be because of water. That could be because of gas. It could be because of anything. It could be just a gastric ulcer as well. You are feeling, upper abdominal discomfort. So take treatment for 15 days or do whatever ghar ke nuske or whatever you want to do. But after 15 days, if you're not able to sort it, better go and meet a gastroenterologist.
Liver detox drinks cleans and heal your liver. Do we have any liver detox drinks?
So it's like telling go and have a bath in Ganga, सारे पाप धुल जाएंगे. I don't
True.
think so. That tells you the answer actually.
So no, the answer is no. So one thing I really wanted to ask you about is, and you must have also seen these patients where once any doctor writes them omeprazole or pantoprazole for their gastritis issues, without consulting the doctor, they keep taking it. So what message do you have for such people who are taking these medicines on a long run without consulting a doctor? Because it kind of gives them some sort of relief. So they keep on popping these.
So this is not the ideal way. You need to understand why you are needing these medicines. Obviously, the patient has some problem. That's why he's taking, right? So the patient needs to understand why I am having this. The question why is extremely important. So let your specialist analyze why you are needing this. Once you identify that why, you correct that so that you don't have to take these medicines. At the same time, see, these medicines have their own set of side effects.
Yes.
They don't come without side effects. See, at the end of the day, they are chemicals. Water is also chemical. If I ask you to drink 10 liters of water, you will also have a problem.
Yes.
So all these are chemicals. None of the chemical is safe. And that's why they have to be given by a trained expert person under supervision. I'll also give one more message to these people who take such medicines on a long-term basis. Check your hemoglobin, check your vitamin D, check your B12, check your bone density, and you will find that all these things have become low because, see, God is not stupid to create acid in your tummy. He has created acid for some reason.
Yes.
It is for digestion, it is for absorption.
Yeah.
By stopping the acid from production using these medicines, you're causing more harm to your body.
And it is also very impactful on the gut flora.
Absolutely. Absolutely. Overall health goes for a toss if you take it unsupervised for weeks or years together.
Yeah. So on that note, before we end today's podcast, we would want to hear some case which was extremely challenging and which has shown which had no hopes of good prognosis, but in spite of that showed good results. I'm sure you will have a lot.
But so
a few.
Over the years of last 15 from 2011 till date, there are umpteen number of cases, to be honest. But one case which I can very easily recollect because we did very recently was, we had one gentleman weighing around 135 kg. 135 kg, and he had jaundice, the yellow eyes and urine, severe pain, and he came in a comatose state,
Acha.
as in he was not identifying, recognized, talking, and his blood pressure was only 50. It's
Mhm.
very, very low blood pressure. So this was all because of infection.
Mhm.
And the cause of infection in this gentleman was one of the gallbladder stone had actually fallen into the bile duct,
Okay.
and the
Blocked it.
the whole bile duct had got blocked. That is why the patient's bilirubin, or the patient had jaundice, and he had infection, and that infection
Oh.
had caused significant lowering of the blood pressure,
Okay.
and the patient was on ventilatory support.
Mm-hmm.
So with low BP and somebody on ventilator, this is like terminal stage for
Yes.
a patient.
Yeah.
So we took the daring decision that we would do an ERCP for this patient. We
Mm-hmm.
did EUS and ERCP for this patient. See, we saw the stone on the endoscopic ultrasound and we did ERCP.
Mm-hmm.
We removed the stone from the bile duct. We put a stent in the bile duct, and the patient's
How many stones were there? Actually.
3 stones.
Okay.
Yeah, so but pretty big, like 10 mm, 10 11 mm.
Wow.
Yeah. So once the stones were removed, the patient was stented. Gradually, patient's blood pressure started improving. The infection started going down. The jaundice went away.
Mm-hmm.
Patient was removed off ventilator. Patient went back home walking. One of the very gratifying case which we just did recently.
Lovely. So, how is the patient doing now?
Wonderful.
Has he come and met you?
Yeah.
So, how does it feel to treat such patients and see such great results?
So, to be honest, when you're handling such difficult cases, you need good organization where you have good OT, you have good gadgets, good endoscopes, good ICU backup, and multidisciplinary care is available. At the same time, you also need a good support from your family, your spouse, kids, and parents, because without this support, you cannot do all these high end things.
So, on that note, wishing you all the best for all the future
Yeah.
endeavors,
Thank you
and
so
may more and more people who need expert treatment are
Yeah.
able to reach out to you. We also expect a lot of viewers can get a lot of information out of this podcast.
Yeah.
On that note, thanking you once again for coming on Sahyadri Health Talks and giving us your precious time.
Pleasure
Thank you
mine.
so much, sir.
Thank you.
This is Dr. Tushita signing off Sahyadri Health Talks.